Bipolar disorder is a brain disorder characterized by extreme or unusual shifts in a person's mood, energy, and ability to function. It affects approximately 1% of the population. More than 2 million American adults currently have bipolar disorder. Mania is a defining characteristic of bipolar disorder and can occur with different levels of severity. More mild levels of mania are often referred to as hypomania. Individuals with hypomania often exhibit energetic and excitable behavior. They may also become highly productive and driven. However, as mania worsens, individuals begin to show erratic and impulsive behavior. They sleep very little and often make poor decisions due to their impaired state. At the most severe level, individuals with bipolar disorder experience psychosis. Psychosis is a generic psychiatric term that refers to a mental state often described as involving loss of contact with reality. Behavior in psychotic patients ranges, but in properly diagnosed psychiatric disorders, like bipolar disorder, psychosis is a descriptive term for the hallucinations, delusions, sometimes violent tendencies, and impaired insight in individual experiences. The other defining characteristic of bipolar disorder is the unusual, intense emotional states that occur in distinct periods, called mood episodes. These episodes differ drastically from a mood swing a healthy individual would experience. Each mood episode represents a drastic change from a person's usual mood and behavior. An overly joyful or excited state is called a manic episode, while an extremely sad or hopeless state is called a depressive episode. A mood episode can also include both manic and depressive qualities. This is called a mixed state. Symptoms of a manic episode include a long period of feeling high or euphoric and feeling overly happy and outgoing. Other behavior changes include rapid speech, racing thoughts, becoming easily distracted, increasing activities, sleeping little or not being tired, and impulsive actions. Symptoms of a depressive episode include an overly long period of sadness or hopelessness, loss of interest in previously enjoyable activities, extreme exhaustion, difficulty concentrating, impaired memory, restless and irritable behavior, a change in eating and sleeping habits, as well as thoughts of death and suicide, and even attempting suicide. As for people experiencing a mixed episode, they may feel very sad or hopeless, while at the same time feeling extremely energized. This state of contradiction can cause distress in itself, therefore individuals typically have a very difficult time functioning during mixed states. Between episodes, many people with bipolar disorder are free of symptoms, but some may still experience lingering symptoms. Bipolar disorder often develops in a person's late teens or early adult years. At least half of all cases start before age 25. The causes of bipolar disorder vary between individuals, but the exact mechanism underlying the disorder remains unclear. However, genetic influences are strongly believed to increase a person's risk of developing bipolar disorder. The risk of developing the illness is nearly tenfold higher in first-degree relatives of those affected with bipolar disorder when compared to the general population. To be diagnosed with bipolar disorder, the symptoms must be a major change from your normal mood or behavior. From there, the disorder is classified into 4 basic types. Bipolar I disorder is defined by manic or mixed episodes that last at least 7 days. Depressive episodes occur as well, lasting at least 2 weeks. Bipolar II disorder is defined by a pattern of depressive episodes and hypomanic episodes. However, individuals do not exhibit full-blown manic or mixed episodes. Cyclothymic disorder is a mild form of bipolar disorder. Individuals experience episodes of hypomania as well as mild depression for at least 2 years. However, symptoms do not meet the diagnostic requirements for any other type of bipolar disorder. Rapid cycling bipolar disorder is when a person has 4 or more episodes of major depression, mania, hypomania, or mixed states, all within a year. Unfortunately, there is no cure for bipolar disorder, but it can be effectively treated over a long period of time. Even people with the most severe forms of the illness are able to gain better control of their mood swings and related symptoms with proper treatment. There are many different medications that can be used to treat bipolar disorder. This is because many people respond to medications differently from one another. Some may need to try several different medications before finding the best option for them. The types of medications usually prescribed to treat bipolar disorder include mood stabilizers, antipsychotics, and antidepressants. Medication can also be combined with psychotherapy to improve the life of an individual even more so. It can provide support, education, and guidance to people with bipolar disorder and their families. If you know someone with bipolar disorder, it affects you too. The first and most important thing you can do is help him or her get the appropriate diagnosis and treatment. Once they have begun treatment, encourage your loved one to continue, and from there you can do a few additional things to help. Offer emotional support, understanding, patience, and encouragement. Learn about the disorder yourself so you can better understand what your loved one is experiencing. Listen to your loved one's feelings. Invite your loved one out for positive distractions, such as walks, outings, and other activities. And lastly, remind your loved one that with time and treatment, he or she can get better. In conclusion, bipolar disorder is just as serious as any other lifelong illness. It has very harmful effects on an individual's life and well-being, and can even take a person's life. Please think more carefully next time you refer to someone as bipolar as a joke. Believe it or not, there are people around you silently struggling with hardships you can't imagine, and it would be much more pleasant for them if you showed your support rather than disrespect. Thank you for taking the time to learn about bipolar disorder. If you have any questions, feel free to ask.